Today, we're diving into a really fascinating condition, one that turns the simplest daily actions into a complex puzzle. We're talking about a disconnect where the mind knows exactly what it wants to do, but the body, well, the body just can't seem to follow the plan.
I mean, just think about that for a second. You want to do something you've done 1,000 times. Comb your hair, cut a piece of paper. The thought is perfectly clear. Your muscles are strong and ready to go. But something gets lost in translation, and the action either goes wrong or just doesn't happen at all. It's a baffling disconnect, and that's the mystery we're going to unravel today.
So, this puzzling disconnect can make the world of simple, everyday tasks feel incredibly disorienting. But what does this breakdown actually look like in the real world?
What's so interesting is that the errors people make aren't just random. For example, if you ask someone to pretend to use a comb, they might run their fingers through their hair, as if their fingers are the comb. Or if you ask them to mime cutting with scissors, they might move their index and middle fingers like they're the blades. The intention is clearly there, but the actual blueprint for the action seems to be corrupted somehow.
So, what do we call this strange condition? Well, the clinical term is apraxia. Let's dig into what that actually means. Okay, so here's the crucial point. Apraxia is about the plan, not the parts. The brain's how-to manual for a movement gets lost or scrambled somewhere between the idea and the action. The muscles are working just fine, the nerves are ready to carry the signals, but the sequence, that step-by-step guide, is what's broken.
And this is a really important distinction to make right away. This isn't about someone being weak or just uncoordinated. It's a higher-level processing issue. It's a cognitive breakdown in the brain's ability to sequence and execute learned, purposeful movements.
Now, apraxia isn't just one single thing. It actually shows up in different ways depending on which part of the brain is affected. So we're going to break down the 4 main types you'll see.
These are the 4 we're going to focus on: ideomotor, ideational, constructional, and dressing apraxia. Each one messes with a different kind of purposeful action, from using a simple tool to just getting dressed in the morning.
Let's start with those first 2, ideomotor and ideational apraxia. Now, both of these have to do with how we handle everyday objects and tools. So how do clinicians figure out which one it is? Well, it actually comes down to a surprisingly simple little test.
It's basically a 3-step process. First, the patient is asked to just pretend to use a tool. The clinician then watches for those very specific errors we talked about earlier, like using a body part as the tool. But it's that final step that is absolutely crucial for the diagnosis. The clinician actually hands them the real tool.
And this is where the difference becomes crystal clear. With ideomotor apraxia, the patient struggles to mime the action, but when you give them the real scissors, the physical object itself cues the correct movement and they can often use it just fine. But with ideational apraxia, the breakdown is much more severe. Even with the real tool right there in their hand, they just can't figure out how to use it correctly. They might try to use a comb by its teeth or hold a fork by its tines.
Now, apraxia isn't just about using tools. The next type, constructional apraxia, affects our ability to understand spatial relationships. This means someone might really struggle to draw or build even simple designs like a triangle or a daisy from memory, because the brain's plan for how all the parts fit together is lost.
And finally, there's dressing apraxia. You know, this quote from a patient just captures the frustrating reality of it perfectly. It's a profound difficulty in orienting clothes to the body. They might put their arms in the wrong sleeves or a shirt on backwards, not because they're weak, but because that mental map for the whole sequence is broken.
So we have these 4 pretty distinct types of apraxia. Where do these different breakdowns actually come from? Well, the answer, as it so often is, lies inside the brain.
Yeah, these aren't just random failures. The specific type of apraxia a person has gives clinicians really big clues about where the damage or the lesion in the brain is located. You see, the brain divides its labor, and apraxia gives us a clear window into that division. And you can see there's a really clear pattern here. The tool use apraxias, that's ideomotor and ideational, are generally linked to damage in the brain's left hemisphere. Meanwhile, the more spatial apraxias, constructional and dressing, are typically associated with damage to the right hemisphere.
Okay, but check this out, because here's where it gets even more fascinating. A lesion on the corpus callosum, that's the massive bridge of nerve fibers connecting the 2 halves of the brain, can cause something called a disconnection apraxia. The command from one side of the brain literally can't get to the other, so the apraxia might only show up in one hand. This is exactly why a doctor will always test both the right and the left hands. So we understand the different types, and we know where they're coming from in the brain. But in a clinical setting, making the right diagnosis is absolutely critical because, well, other conditions can look pretty similar at first glance. One of the main diagnostic challenges is telling apraxia apart from something called spatial neglect. Both conditions can cause some pretty strange errors in things like drawing or dressing, but the pattern of those errors is completely different.
Let's look at a drawing test, for example. With constructional apraxia, the person's attempt to draw, say, a daisy is disorganized all over. The entire plan is flawed. But with left neglect, a patient will draw the right side of the daisy perfectly, but then completely ignore the left side, as if, to them, it just doesn't exist. Making that distinction is absolutely vital for the right diagnosis and treatment.
So, what are the key things to take away from this journey into the brain's blueprint? First, just remember that apraxia is a breakdown in the plan, not a problem with physical strength. Second, we've seen how it can show up in 4 main ways, affecting everything from using a fork to getting dressed, and each one maps to a specific side of the brain. And finally, and this is the most important part, understanding this blueprint allows for targeted occupational therapies that help patients find new strategies to get things done.
And that kind of leaves us with a final thought, doesn't it? We perform thousands of these simple actions every single day without a second thought. But conditions like apraxia pull back the curtain and show us the incredibly complex, silent symphony of planning and execution that our brains are conducting every single moment. It's just a profound reminder of the intricate blueprint behind every single move we make.